The controversial topic we'll be discussing today is prenatal genetic testing by Stephanie, Olivia, Aaliyah, Sophia, Liliana, and Natalia. So to start off, what is prenatal genetic testing? Prenatal genetic testing is a group of medical procedures or tests that will provide information about the health of a fetus and pregnant mothers. It can be thought to have many benefits, but also many points to consider. These procedures aim to give information about potential genetic disorders or birth abnormalities ahead of the birth of a baby. Pregnant mothers have many routine prenatal tests that must be taken throughout their pregnancy to assure the baby is healthy, but prenatal genetic tests are not part of this. Instead, prenatal genetic tests are optional, as many people may not want to take these tests and find out their baby will be born with a congenital disorder ahead of their birth. Because these tests are optional, not all insurance covers them. Depending on the insurance, these tests may only be covered if deemed medically necessary or if the fetus is thought to be at risk of something. There are two kinds of prenatal genetic tests for a fetus. One kind is screening tests and the other is diagnostic tests.
Prenatal genetic tests are divided into screening and diagnostic tests. Screening tests are very safe and include blood tests and ultrasounds. However, they only show the risk of having the condition, not a diagnosis. These are done between months 2 and 5 and look for things like chromosome disorders such as Down syndrome, genetic diseases like cystic fibrosis, and physical abnormalities. If a screening test shows a higher risk, diagnostic tests like chorionic villus sampling or amniocentesis can be used to provide more accurate results and diagnose. Chorionic villus sampling can be done in month 3, and it's where cells from the placenta are biopsied and tested. CVS can be used to determine chromosomal abnormalities, genetic disorders, and sex-linked disorders. Amniocentesis can be performed as early as the 4th month of pregnancy and involves taking a sample of amniotic fluid to test for genetic conditions, chromosomal abnormalities, neural tube defects, and to assess overall fetal maturity and health. Both of these diagnostic tests provide highly reliable results but carry higher risks, including miscarriage, infection, injury to the fetus, bleeding, and amniotic fluid leakage.
The ethical argument. Those who are for genetic testing argue that genetic testing provides better medical care and prevention. Also, that people can make more informed choices about family planning if conditions do arise. For example, if a patient is diagnosed with with a condition in the womb, the family is able to educate themselves and make more informed decisions. Also, medicine can be personalized to individuals. Doctors and healthcare providers are able to study the patient and make a personalized treatment plan instead of just using the regular protocol that might not be perfect for that patient. Also, the data gathered from genetic testing can lead to treating and curing diseases, which would benefit everyone. Those who argue against genetic testing argue that there is unequal access to genetic testing, and it may be more accessible to wealthier groups as it is very expensive and not covered by all insurances. Also, it can cause distress, especially for conditions that have no cure. There is nothing that the family could do, and it just causes a lot of anxiety. Also, the pressure of termination. If the test does come back positive for a condition, doctors usually pressure the mother into terminating the pregnancy. Also, false positives also may arise, which cause unnecessary stress and anxiety, or also unnecessary termination of pregnancy.
Now that we've discussed what prenatal genetic testing is, I'm going to talk about some of the pros and cons associated with it. While these tests can offer valuable information, they can also come with limitations and concerns. Starting with some of the pros, one major benefit of prenatal genetic testing is that it can help parents prepare for a child who may be born with a genetic condition. For example, if a condition like Down syndrome is detected, parents and healthcare providers can plan ahead for the delivery, prepare for possible complications, gather needed equipment, and learn how to better care for their child after birth. It allows families to access support, systems, and resources early on. Another benefit is reducing anxiety and uncertainty. For many parents, not knowing can be very stressful. Genetic testing can provide reassurance or identify concerns early, which can offer peace of mind and help parents feel more informed during the pregnancy. A third advantage is early detection of genetic conditions. Conditions such as cystic fibrosis or even sickle cell disease may be identified before birth, allowing healthcare providers to create a treatment plan early and improve the baby's care, quality of life, and overall outcomes. Prenatal genetic testing can also help the pregnancy preparations. It allows doctors to monitor the mother and baby more closely and provide any specialized care that may be needed throughout the pregnancy. However, there are also some cons to consider. One limitation is the possible of false positive results. In some cases, a screening may suggest a problem when there actually isn't one, which can cause unnecessary emotional distress, anxiety, and stress for parents. Another concern is cost. Some prenatal genetic testing may not be fully covered by insurance, which can create a financial strain for families while they are also coping with concerns about their pregnancy. There are also ethical concerns. Some parents may struggle with decisions relating to the testing because of personal beliefs, religious values, moral concerns, or even pressure from family members. Lastly, prenatal genetic testing can create emotional stress regardless of the results. The process itself can bring feeling of fear, uncertainty, and anxiety for expecting parents. Overall, prenatal genetic testing offers many benefits, especially in preparation of early detection, but it can also come with emotional, ethical, and practical challenges.
In recent years, there have been many advancements regarding prenatal genetic testing. These advancements not only have improved the safety of these tests, but they've also improved how much these tests can actually detect. For the first advancement that we found is cell-free DNA testing, which is non-invasive testing using tiny DNA fragments from the placenta in the mother's bloodstream. This is way less invasive than actually entering the amniotic sac to get fluid out of it for testing, and it doesn't really affect the fetus at all. The next thing we found was next-generation sequencing, which allows tests to detect chromosomal problems, DNA changes, and single-gene diseases. This greatly expands how many conditions that can be detected instead of just like the basic things like Down syndrome, cystic fibrosis, and other things like that. And adding on to the next-generation sequencing, there's genome and exome sequencing, which now doctors can focus on important gene parts and see all the genes of a baby. This provides a full picture of the DNA, and it's even said that these tests can actually detect up to 85% of known diseases that are related to DNA mutations.
There are several different stories of prenatal genetic testing, and while some may go right, others can go wrong. A story of it being a positive experience is about a mother who learned during her pregnancy that her son had Down syndrome through prenatal genetic testing. Although it was overwhelming, she explains how it was a positive experience since she was able to process the news before giving birth and prepare for the child's needs. Due to the early diagnosis, the doctors were able to monitor her pregnancy and plan for any complications. She explains how the preparation helped reduce her fear and allowed her to focus on bonding with the baby. Now, another story of it going wrong is about a mother who received taking prenatal screening during her pregnancy and received high risk, suggesting her baby might have a genetic condition. The news caused fear and uncertainty, making her family struggle, but later more accurate testing showed the last result was wrong and the baby was actually healthy. She reflects that the experience was very stressful and expresses how false positive can create anxiety and pressure for parents, which can cause further problems in the future.
These are our references, and thank you for listening.